Welcome to Pedo Teeth Talk, brought to you by the American Academy of Pediatric Dentistry, a podcast show that delivers cutting-edge ideas for the professionals specializing in pediatric dentistry.
Thank you for tuning in to Pedo Teeth Talk, where we bring you the contemporary issues important to you and your practice, brought to you by the American Academy of Pediatric Dentistry. Thank you to our Pedo Teeth Talk sponsor, Ep.21, for helping us bring you great content. We couldn't do this without them. Visit them at www.hufriedy.com. That's h-u-friedy.com. We're here today with Dr. Purnima Hernandez, who's going to talk to us about autism and how it relates to pediatric dentistry and tell us about her journey, her learnings, and enlightenments. We're really honored to have you, Dr. Hernandez. I'm going to introduce you first, and then we'll get into this conversation. So Dr. Hernandez is a board-certified pediatric dentist and behavior analyst who has been serving the communities of New York and New Jersey for over 25 years. Dr. Hernandez received her education in pediatric dentistry at Columbia University College of Dental Medicine. After serving as an assistant professor for many years in the Department of Pediatric Dentistry, she decided to pursue a career in the clinical practice of pediatric dentistry. And in 2005, she established her own office in Fair Lawn, New Jersey. She then pursued a master's in applied behavior analysis from Caldwell University in New Jersey. While she delivers care to all children, her special interests are treating children with special health care needs. Dr. Hernandez is also a parent of a child with disabilities. She's an advocate not just for her child, but other children in the community. She has spoken to audiences on various topics related to disability, such as health, advocacy, therapy, and special needs dentistry, and has authored and co-authored many articles related to disability issues. She has served as council member on the Council of Developmental Disabilities in New Jersey and a board member for Disability Rights New Jersey. Dr. Hernandez was awarded the Dr. Solomon Rosenstein Visiting Professorship and Fellowship by the Columbia University College of Dental Medicine for her contribution to the field of special needs dentistry. She was also awarded the Francis Black Humanitarian Award in healthcare by Friends Health Connection, an award that recognizes individuals from New Jersey's healthcare facilities who are doing an extraordinary inspiration to many others. Dr. Hernandez and her practice were featured in 2 television news stories, CBS and NJN, as well as the subject of an in-depth article in the Jersey Star Ledger. So we are really honored to have you with us today. We're live at the annual session of the American Academy of Pediatric Dentistry here in the exhibit hall. And this is going to be, when our audience is listening to this, you will hear it from another place, but we're excited to be here at the show. And I think to start, Dr. Hernandez, first of all, thank you very much for being here with me today and agreeing to do this.
Yeah, thank you so much for having me. I'm so excited to share my journey and a little bit of what I have learned through it to make a better place for our children with autism. Thank you.
Yeah, you said journey, and I think that word came out during our interactions when we were talking about doing this podcast, because although obviously you have so much to tell us factually and some of the things you've learned as a behavior analyst, we want to talk a little bit about what that means to us in pediatric dentistry, because you've gone on and had a second career that you now have merged with your other career in this subject. But, in terms of the passion that you have, the journey that has led you to this is part of what we're going to talk about today. So I just want to start with that and say, what knowledge have you gained from this personal journey, and then we'll explore that in detail, but tell me more about the journey, if we can start with that. How would you describe this journey that you've had?
So the journey is a very long journey. It's been about 22 years when I had my son with autism. A day in August in 1997 just changed my life. And while it seemed very dark and grim on that day, it actually was a beautiful opportunity that came my way. So it has been fantastic.
So I'm sorry, so your son was born in 97?
He was born in 97. Mm-hmm. He's going to be 22 years old today. Okay. And that is how I first became introduced to special needs, I would say, and autism is just one of them.
So you learned about the disability at the time of birth, or was it thereafter?
When you're born a pound, you're pretty much assured that there are going to be some issues. Mm-hmm. And in my case, my son was not one of those lucky micropremies. He really had many issues and is left with many residual issues.
I see.
That we have. So, it's sort of like global.
I see. Okay. So maybe to expound a little more, on this personal journey, you became interested in working with other individuals with special needs, specifically individuals with autism spectrum disorder. So tell me more about that, please.
So he stayed about 6 months in the NICU, and it became very apparent to me that, having a full-time private practice was impossible. So I quit private practice and I became a full-time caregiver as well as his parent. And I differentiate caregiver because as a caregiver, I became involved in his therapies and delivering them throughout the day. So I immersed myself in learning, taking courses related to every issue that he had. So if I was studying something, if he had something in regards to speech therapy, I would take a course in that. Behavior. He was in a school program that he was homeschooled. So he went to a clinic during the day, a very well-renowned autism clinic, and I was very fortunate at that time to become trained in his daily programs because I was, taking care of him all through the day.
Right. Did you feel, if I may ask,
yes.
So you're confronted with the need to do all these things that you suddenly had to do.
Right.
And you said you quit your other job in order to be able to be prepared to do this. Did you feel there was an adequacy of information? Because you talked about how you had to learn what to do.
Yes.
It was thrust upon you. Did you feel like there was adequate information available to you as a parent of this child to take care of what you had to do?
The thing is, sometimes when you have a situation like that, you don't even know what information to get.
Right.
So it's a journey in itself,
I see.
As issues presented, I immersed myself in learning, and as I learned, it opened up just new avenues for me. And that's how I got introduced to applied behavior analysis, because at age 3 he was diagnosed with autism. Since it is a behavioral diagnosis, our applied behavior analysis is the most evidence-based strategies that have really influenced individuals with autism. And
how did you get exposed to this behavior analysis? And tell me about that.
So I used to go to the clinic where Narayan was, and I got trained in his daily programs. So at that time, as a parent, I had to run competencies, and this renowned behavior analyst was running the clinic. And I thought it was really amazing to see how children were learning. I mean, here were children with cognitive issue and certain deficits and impairments, but yet they were learning some high-level skills using applied behavior analysis strategies. And that is how I got introduced to it.
So it seems at that time, or perhaps thereafter, and that's why I wanted to ask you, did you decide to become an advocate for others, and that's what you've become as a result of your experiences. Was it, at what stage, I guess I would ask, did you decide, wow, not only am I helping myself doing what I need, but I can now help others?
Right.
When did that transition, that journey occur?
So that's a great question. About 5 years into taking care of him home, I got a phone call, and it was from a local craniofacial team inviting me back to work. And I did everything to sabotage that experience because I was, I think, very fearful about getting back to work. When I got back to work, I did join the team for about half a day a week. I realized there was a shift in my practice, that my children with disabilities, I was a lot more effective in managing their behavior, teaching them skills. And I was, I think, drawing from my experience with my son through all those courses that I had
and your personal experience. I mean, courses are one thing, but the personal experience, you actually had trial and error, so to speak.
So with the practical experience, I think that was really key, is being in the pit with my son and using those strategies on a daily basis to see what worked, what didn't work, and then adapting them to a dental environment was really very exciting. I knew that there were changes and I needed to learn more about behavior to have a little bit more in-depth understanding on how this works. So
can you please tell us a little bit about the behavior analysis per se, and what made you realize that's what you were already doing, and then you got introduced to the discipline, this thing called behavior analysis.
Right.
And so what is it for us who don't know about it like you do? And maybe we can get into what did you learn in your master's training, And then we can talk later about how you deploy that in your practice today as a pediatric dentist.
So as a behavior analyst, we help in changing socially significant behaviors. And what I mean by socially significant are not just any behavior, but a behavior that will help improve this person's life and help them access more reinforcement. Ultimately, that's what we want. And I think what I brought back to the dental office in that dental environment is to really look at behavior a little bit more objectively rather than emotionally. So what does that mean? We often talk about children being scared or they're anxious, or we describe a parent type.
Yes.
And all that is great.
We do that all day long.
We focus on
That's
it.
the backroom conversation with the staff,
Yes.
right?
And I have it too, don't get me wrong.
We have acronyms. And
Yes, exactly. And we won't talk about the acronyms right now. But really, the acronyms just inform us just a little bit about the child's behavior, but it doesn't give us the skill that is needed to change and modify that behavior in the bit, right? So how do we get to that? How do we change behavior in the bit is not by how the mother or the father or the assistant or the doctor behaves. It's about what the child is doing. So for give you an example, when I look at behavior, I really look at, okay, here's the child engaging in some problem behavior. I identify certain target behaviors. The child is slipping off the chair, covering the mouth. These are all objective and measurable. Now,
there are also things that interfere with your ability to treat, right?
Exactly.
That's the common
so,
thread.
for instance, crying, and we talk a lot about crying.
You and I were discussing that earlier.
Exactly.
Yes.
Crying is really a secondary behavior. It may be a precursor to other problem behaviors, but it doesn't interfere with crying.
Right.
And Joel,
it's a surrogate almost.
Right.
It's not really a real outcome.
Yeah, it took me a long time to really get that. And even though I've been doing this 12 years, it is just about 4 years ago when I was writing a lecture, I said, wait a minute, crying is not socially significant. Children cry. It's a human response. But it is socially significant if the child cries and controls my hand or kicks me or slides off the chair. So crying is secondary.
You're teaching the behaviors, you're correcting or you're intervening on behaviors that are important not only to the child but to you, the practitioner, and the team, so I can accomplish what we need to do today. And you're also teaching the fact that that's what's important, so that the child understands that, right?
So actually, yes and no.
Okay.
So when we are modifying behavior, we often think of behavior as really problem behavior, good and bad behavior. But that's really not what behavior is. Behavior is everything we do. We're talking, and that's behavior. I'm thinking, I'm looking at you. And here's one of the things in behavior analysis that we learn. If a dead man can do it, that isn't behavior. And that's really powerful because now we can use the behavioral principles to really change behavior. But in behavior analysis, we are not talking about changing thinking and changing physiologic responses, although we can, as doctors talk about it. They look at behavior that's objective and observable, and then using behavior techniques very systematically to increase compliancy and decrease non-compliance. It's really beautiful because it's almost like having two knobs and you move them in the direction you want them to, using strategies applied very systematically. And currently we have beautiful behavior guidance techniques, but we don't have a system on how to use it. And there is a system. I didn't create this. I just learned it in practical application for 5 years with my son. I went back, got a little more in-depth understanding.
This is the training.
To understand.
Behavior analyst.
Exactly.
Yeah.
And then apply it with children daily in the chair. And my recent effort is, how do I make this happen for everyone to be able to do it faster and more efficiently?
Could you give us one example of what you learned in this behavior that applies to pediatric dentistry? You were talking in general here about the important outcomes. You can't be sliding out of the chair.
Right.
You can't put your hand over your mouth. We need to get some things accomplished today. So give me an example of how you would deploy the behavior analysis in a procedure or in the dental office.
Let's say, I have a child who does not like certain toothpaste. And we have so many of children with such taste sensitivities. Sensory issues. They have no cognitive issues maybe, but a strong taste sensitivity.
Very common.
So when they come in, they already have learned that when I go to the dentist, this is what I'm going to taste, and I don't like that toothpaste, so I'm going to engage in this behavior. I'm assuming that's what they are thinking, and they engage in escape-related behaviors. So they're getting out of the chair, crying, jumping, covering their mouth. So some of the things that I would probably do is really look at in observations, what are some of the behavioral characteristics of this person? She doesn't like taste. All right, I'm going to keep that in my data bank. What does she do in the chair when she doesn't like it? Now, depending on how old the child is and how big, I would use certain strategies. So I generally try to use reinforcement-based strategies, which is using a reinforcer for engaging in a favorable response.
A positive reinforcement.
Positive reinforcement.
Some of the things we do with thumb-sucking behavior, we often do positive as opposed to negative.
Exactly.
Works better. Yeah.
But here's the thing. What does the child really want? The child really wants to get out of that room.
Right.
Escape.
That's their goal, yep.
Their goal is, let me get out of there. So what is more favorable? Does the child want the toy or do they want the escape? They want the escape.
Yes, okay.
So when you provide escape, think of escape being a reinforcer. It's an extremely powerful. We don't think like that in pediatric dentistry.
How do you make it a reinforcer? Escape.
You give it non-contingently. Or contingently. You can arrange with the child that if you allow me to clean a quadrant in your mouth with this prophy angle, you get a break for 5 seconds and you set a timer. That's escape from the chair. That's the most powerful reinforcer.
Knowing what they want. It's kind of like motivational interviewing a little bit.
It is. And actually, most of my children who might engage in problem behavior, and not even just autism, working with autism and using applied behavior analysis is the way to get into challenging behaviors. But it's really behavioral principles apply to everyone.
Oh, wow.
So basically, if you are able to arrange for escape as a reinforcement. Now, in my lab tomorrow, when I will be showing a case, I'm going to show non-contingent delivery of escape and what that looks like.
This is such great stuff, and we don't know. We all experience this. Yeah, that's fantastic.
And the behavior changes so rapidly. My raw videos are literally 4 minutes.
We will pause now for a word from our sponsor.
Hugh Freedy is the global leader in dental instrument manufacturing and infection prevention solutions that keep you performing at your best. For more information on Hugh Freedy products, visit hughfreedy.com/AAPD-crowns. That's hugh-freedy.com/AAPD-crowns. And enter the promo code 2682 if placing an order for Pedo Crowns.
We are back with Dr. Purnima Hernandez talking to us about her personal journey related to both the fact that you had a child 22 years ago with disabilities. It caused you to change everything in your life to become a learner, and now you're a teacher to others. And you just taught me a lot of things already today, and you've got a seminar here, a hands-on session at the APD. And I want to talk to you about this personal journey. It's been very intense. You managed to go back to school in the midst of this. You managed to practice in the midst of this, a family, and now you're lecturing on it, which we're grateful for. How did you do all that? What made you? Where did the passion come from for that?
Well, the practical training was really amazing. I had mentioned that before. And when I went back to practice, that had made such a shift in my practice. I also realized that I am the constant in my son's life. So I would need this information for the rest of my life, but I wanted to bring it back to my profession. So I went back to school. I took my husband on a date, and I said that I needed to go back, and this had to be a joint decision because it was a 6-year evening night course with everything else that I was doing.
That was a good date, right?
It was. He's afraid I'm going on dates with me now, but because I'm always joining a journey. Yeah. But it was.
You present a good case, I bet.
And that's how I went back to school. I needed his support, and it was challenging. And it was challenging because of my own personal expectation of excellence in the program. And I'm so glad I went back. Yeah.
So you gained some knowledge from this. You've obviously been talking about this. What have you gained personally on this journey, your son's intense effort at rehabilitation and education, regarding his own improvements? What have you learned about that?
So about him in general, what I've learned, and I think the biggest message he's taught me, is that ASD or autism is not a neurodegenerative disorder. Children are learning. It's a spectrum. So you can have, low-level learners or high function, but they're all learning. And that's really powerful, because that means I can teach them skills. They're learning skills that are so much more complex than sitting in a...
You can see the impact. You can see the impact of your own... others encounter your son episodically. They see him at a point in time, and they interact on that basis. Right. You are the only one, really, who's seen... Your husband and you have seen this growth occur over time. And you've seen the results, as you said. You've tested things. You've seen what works and what doesn't. And now you're sharing it.
It is. And it's really beautiful when he was born 1 pound and not moving, to have sort of regained so many skills. I think it just speaks so much about we don't know about the brain. And it's very hopeful.
It's fascinating stuff. This is a topic we could go on for days about. But I'm hoping that our listeners today will be inspired, as I am, by listening to you, to learn more. Because all of us interact with patients with special needs, and we're always looking for better ways, and who better to learn from than you, who's had this journey. How have you, so specifically, maybe some other examples of how you've included this personal experience and knowledge into your private practice? Has it changed the practice itself?
Sure. One of the things that we talk about in special needs as a parent, you start very earlier on, is to realize you want to make the children independent and to bring them to least restrictive environments. So I have brought that same concept back to the practice, is making each child independent in my chair and using the least restrictive procedures. So that's, I would say, is very powerful for me. I also look at behavior objectively and look at what behavior I can change and modify to make the child successful in their dental visits. And for this, I try to really figure out what is that individual's behavioral characteristics. So getting to know them. So you were talking about motivational interviewing, and every parent gets a phone call from me. I get to know the child and understand their needs, who they are, what their previous dental experiences looked like, their sensory issues, and I even identify reinforcers by phone. And so by the time they come in, I have adapted my environment for that child. So customizing the dental visit, because each child is unique, is very powerful.
So it sounds like you have 2 goals at every visit, particularly with special needs patients, that you have the goal of, I've got to get the treatment performed that I need to do today, but perhaps more importantly, you have this longer-term goal of improving their ability to be a patient, to interact.
Absolutely.
You talked about interacting in society. The social interactions. This is an environment in which they need to interact to be successful. You're giving them a life skill.
Absolutely.
Really, which is not only applicable to the office, but for their other parts of their life.
Absolutely. I now lecture in healthcare environments as well as with behavior analysts. And one of my messages that I share with them is that my child may never go to college. My child may never have a job. But he's definitely going to experience healthcare environments. And they are so phobic, the responding for our children, because these are very tough environments for them. They are just a poor fit for healthcare environments. So I have I encourage ABA programs to include healthcare goals and tolerance to routine procedures in their teaching, in their daily program.
Do you find that as your son is now an adult, that it's more challenging to find environments that are amenable to his medical management? Pediatric dentists this is part of who we are, although we can learn more from you. But it seems like that's less available in other environments. I'm not talking about dentistry. I'm talking about healthcare.
Absolutely.
You've seen it all.
Yeah. We're right in the midst of transitioning him from peds to adult, and that transition is difficult, not just in dentistry, across the board.
Right.
But being a parent advocate and involved in his program, this has really helped me, and I'm so glad that I had the wisdom to do it then, because I'm not sure how I would have transitioned him. There's no one space that is ready for a child with so many deficits.
Well, I'm listening to you, Purnima, and you're very passionate and knowledgeable. But when you wake up in the morning, I want to know what gets you going. With all this stuff you're dealing with, what gets you going in the morning?
The word that comes to me, Joe, is freedom.
Freedom?
Yes, and let me explain this to you. The day my son was born, I lost freedom. And it isn't the freedom of traveling to Europe. It isn't the freedom of taking a vacation somewhere. It was this freedom of thought that what happens when I am gone? How is he going to learn all these skills, and how is he going to manage? So when I get to that office, and in the morning when I see my challenging patients and the parents walk in, I feel so grateful that I'm able to give them freedom from dentists, because their children, by the time they finish with me, have learned how to go to their dentist, and I generalize the skills so that they can go to anyone. And that is so powerful, those transformations.
You're teaching them to help themselves. You're giving them something back. That's such a tremendous thing. Yeah.
That the parent don't have to worry about this one thing in their life. And that is freedom. And I love that.
That is... It makes us all passionate when we listen to you about this. In our last minute here or so, share a couple of nuggets with us for our listeners who are practicing every day. You've talked about some things, but maybe a couple of quick take-home messages for us.
When working with autism, I think that the child has to be prepared, because they may not understand everything that we are saying, and our procedures can be very, very invasive to them. And so them learning in an environment that's conducive to them, with people that they're used to, and using strategies that they're comfortable with, I think is essential. So preparing the kids, and for us as pediatric dentists to understand that this is a team effort. We cannot do this by ourselves. We can teach and generalize skills that they have learned in the home environment, but that work has to be done as a team. So including parents as part of the team, training the parents, having them understand what they need in this environment, I think is really, really crucial. And lastly, not forgetting that children with autism can learn. So I would say, don't just practice dentistry, don't just deliver dentistry, teach dentistry. And I love that.
Wow, what a powerful message for us today. Thank you so much. I only can say I hope you'll continue to educate us, because you have so much to offer with your personal experience now combined. I don't know where else that's occurred to this extent. And I love the fact that you wake up every day with the message you have to yourself, the freedom as you described it.
Yes.
So I'm going to listen to this myself when this goes live, because it's such an important message for a lot of what we do.
Thank you so much.
I really appreciate you taking the time to give us to us, and hope a lot of people who are here will go to your course tomorrow and all your other lectures that you give.
Thank you so much.
Thank you very
so
much
for having
me. Thank
me.
you, Dr. Hernandez, and thank you for tuning in to Pedo Teeth Talk, where we bring you the contemporary issues important to you and your practice, brought to you by the American Academy of Pediatric Dentistry. Thank you to our listeners. We look forward to seeing you next time.
Pedo Teeth Talk is brought to you by the American Academy of Pediatric Dentistry, the show that delivers cutting-edge ideas for the professional specializing in pediatric dentistry. If you have any questions or comments, please email info@aapd.org. We welcome your ideas for future shows and guests. For more information on the American Academy of Pediatric Dentistry, visit aapd.org.